Ito naman. Oh, there you go. Okay, so let us begin with our PowerPoint. Okay, so I've already told you your learning outcomes. So a normal person breathes about 25,000 breaths per day, and that is about 10,000 liters of air. And as you know, di ba yung air natin, it's not comprised mostly of O2. Alam mo na nitrogen ang marami sa atmospheric air. So you need to breathe in, more times because you need the oxygen, in the air. Now, the lungs is a series of built-in barriers and defenses to protect function and life. When we talk about built-in barriers, so dapat we are also familiar with the anatomical structures ng ating respiratory system. So however, alam natin with aging, part yan na nagkakaroon ng decrease in our defenses, and also sometimes there is damage to the lungs. Sorry for my dogs. Midnight. No. Okay, so let's have a review of the anatomy and physiology of the respiratory system with this video. Okay, so as you know, ayan, so the major organ of your respiratory system includes your lungs, yan, major organ yan. But the respiratory tract begins with your nose, your nasal cavity, and your mouth. So air could enter into the nose or into the mouth. So inside your nose, so it is divided into nares. Okay, so you have your nasal septum that divides the nose, the nasal passage into nares, left and right nares. Now, the nasal cavity is lined with cilia, which means that the cells in the respiratory tract is your pseudociliated epithelium. Now, lined with cilia, meaning puno-puno yan ng hair. Okay, and it is filled with mucous membranes and also blood capillaries. Now, it's important for us to know that, so are you familiar with the process epistaxis? What is epistaxis?
Nose bleeding, ma'am?
Yes, nose bleeding. So, usually, kailan mo sinasabi yung, pag may kausap ka, kailan mo sinasabi na, I nosebleed?
Pag may nag-i-English po, pag nag-i-English si Bayani.
Pag nag-i-English si Miss Bayani, sinasabi natin, ay nako, epistaxis. Pero mas better na kesa sabihin mong epistaxis, dapat mas social ka daw. Sabihin mo kung ano yung dumudugo every time may epistaxis. And these are the blood vessels known as your Caesalbax plexus. Ayan. The Caesalbax plexus are the blood vessels that line yung upper portion ng iyong nose, your nasal cavity, and yan yung dumudugo kapag ikaw ay may epistaxis. So pag may nag-English, instead of saying, oh no, epistaxis, you say, oh no, my Caesalbax plexus. Ayan, di ba? So di ka niya na-gets, mas social ka. So anong function ng cilia? The cilia is the one that filters the air. So alam natin may mga pollutants yung air. So every time, so yung cilia mo, yun yung nag-filter out. Kaya nga, pag nilinis mo yung ilong mo, meron kang makukuha na mga mga pollutants, no, na nandiyan sa ilong mo. And then if I ask you, ano daw yung kapag ka daw nasa city ka, yan, ano yung kulay ng iyong kulangot? Hindi ba kulangot 'yon? No? Anong kulay ng kulangot mo pag nasa city ka? Pag polluted yung air. Na-try niyo ba maglinis ng ilong? Anong kulay?
Dark po. Black or gray.
Black po.
Correct, black or gray.
Black.
Kapag what if kapag ka daw nandun ka sa clean air? Wow, clean air. Nasa province. So, anong kulay?
White.
White? Grabe. Grabe na yung white. Yan. So, siguro mga pa rin, mga brown, gano'n. So, syempre, di ba, ang na-filter out naman niya ay pollutants pa rin, no? Baka kung white yan, baka iba po yan. May nasingkot kang kakaiba. Baka kung hindi drugs, ewan natin, semen, ewan ko. Ayan, so it's also moistened. So aside from that, you have your mucous membrane which moistens the air. Kasi as you know, oxygen is or has a drying effect. Have you ever tried having nasal congestion? So yung halimbawa yung meron kang sipon, tapos wala kang choice kung hindi huminga sa bibig mo. Okay, pag huminga ka sa bibig, na-try mo ba na parang natutuyo yung laway mo? Have you ever tried that experience? Pag meron kang nasal congestion?
Yes po.
Okay, because the reason for that is because you have it's because oxygen has a drying effect, no? Kaya kailangan niya ma-humidify. Napapansin niyo po ba yung mga oxygen tanks? Merong water. Yun yung pang-humidify. Kasi pag O2 lang, wala. Madadry yung yung nasal cavity mo. So kailangan humidified air. And the mucous membranes are the ones that actually moistens the air. Unless of course they are, damaged or may problema kung bakit hindi nila magawa yung function nila. Next is your blood. The blood, yung Kieselbach's plexus, ang purpose yan, it is that it warms the air in your nose. So that's also the reason why kapag sobrang lamig at sobrang init, there's a possibility for epistaxis. Kasi nga, di ba, pag sobrang lamig, so pupunta doon, mag-rush doon sa area yung air para i-warm siya. Ayun, it can lead to nosebleeds. And also, if it's too hot, so there's a possibility, pag sobrang init naman, there's vasodilation. So ganun din, pwedeng mag-bleed out ka doon sa iyong ilong. So these are the functions of your nasal cavity. Now, aside from that, so the nasal cavity houses one of the most most effective filtering mechanism in that it has its concha sa likod, no? So yung nakikita lang nating nose na exterior, parang napakaliit lang niya, no? Halimbawa nga yung nose natin, di ba? How do you, pag kinapa mo yung ilong mo, sige, kapain mo. Pakikapa yung ilong. Yung nose mo, yan ay cartilage. Ang bone lang po dyan is the nasal bridge. Di ba? Pag kinapa mo, the whole nose is cartilage, but the bridge, the nasal bridge, yan lang po yung bone. Yan. Kung meron. Yan. Kasi syempre, Pinoy tayo, di ba? Minsan walang nasal bridge. Alam mo, mag-shades ka naman. Pwede ba pakitali yung shades ko kasi nalalaglag. Ayan. So, the next portion of the nose, after the nasal cavity, in the posterior portion is your nasopharynx. So, kasi yun yung first part ng pharynx. So, the pharynx is divided into 3 parts. You have your nasopharynx, oropharynx, and laryngopharynx. So, nasa likod ng bibig is oropharynx. Nasa opening ng larynx is, or portion ng larynx is laryngopharynx. So, that is now your pharynx. Now, because of this, there is a connection between the nose and the mouth. Yan. So, may connection sa nose and mouth, and that is the pharynx. Because pharynx is the common passageway for air, food, and water. Okay, so let's continue. So every time you breathe, the air is supposed to go to the anterior portion, which is your trachea. Now, kapag naman food ang nandiyan sa bibig mo, one of the cartilages of your larynx, which is known as your epiglottis, closes off the trachea so that the food will go to the posterior portion, which is the esophagus, papunta sa stomach. Kapag hindi niya yun nagawa, it will lead to aspiration. Kaya nga pag sa mga matatanda, tas hindi na ganun ka-sensitive or may weakness ang kanyang swallowing reflexes or swallowing muscles, there is a risk for aspiration. Okay, because of the function of your epiglottis. Now, the larynx is also known as your vocal cords or voice box. So, para pag di ka malito sa pharynx at larynx, ako ay student, ang tinatandaan ko lang, la, larynx. Ibig sabihin, yun yung voice. So the larynx, the voice box, will not make a sound unless air passes through it. So hindi siya walang sound unless air passes through it. That's the reason why if you have a tracheostomy, you lose your voice because the air will not enter the larynx anymore because it's, hanggang dito na lang siya sa trachea. Okay, let me highlight that out. Ay, highlight, mali pala. Let me point that with laser pointing. So, ito yung larynx area. Pero pag may tracheostomy ka, so dito yon. So, yung cricoid cartilage, yan. So, the doctor will make an incision here. So, the air will enter in this area and will also exit in your tracheostomy. So, ibig sabihin, wala ka na ngayong voice. Kaya kung mapapansin nyo, yung mga pasyente mo na may tracheostomy, para makapagsalita, tinatakpan yung butas ng trachea para yung air pumunta doon sa larynx para magkaroon sila ng voice. Okay, so that is the larynx. Okay, let's continue. So, after the larynx, you have your trachea, which is contains about 15 to 20 C-shaped cartilages that is found in the anterior portion of your neck. Yan. And then it will extend to the bronchi. Maghihiwalay siya, right and left main bronchus. It will now go to your dulo terminal bronchioles hanggang sa alveoli, which is the alveolar sacs are the site of gas exchange, because this is where diffusion happens. It's filled with blood vessels and it inflates and deflates. Now, as you can see, your lungs also, you have two lungs. Pag tinanong ilang lobes, 5 lobes, 3 on the right and then 2 on the left, which is super cool because on the left side is actually where your heart, on that empty spot for the lobe, is where the heart resides, no? So just right on that spot. Kaya yung heart natin is slightly to the left side because the left side has only 2 lobes and there are 3 lobes on the right. Okay? And of course, as we said, it inflates and deflates, and your lungs, ayan, through the process of diffusion, ayan, oxygen will go to the blood, and carbon dioxide as a waste will be excreted out to be breathed out of your respiratory system. And that is how gas exchange occurs. Let's continue. Okay, so as I've said, okay, so ito na yun. So you have your lungs, airways leading to the lungs and the blood vessels in the lungs, and you have your chest wall, which is your thoracic cavity. The thoracic cavity maintains the negative pressure inside the lungs to make sure that it inflates and deflates. So parang siyang yung halimbawa yung imagine your dropper, medicine dropper, no? 'Di ba kailangan mo ng negative pressure para yung medicine masipsip nung dropper. Kailangan may negative pressure. Kaya pinipress mo muna yung dulo ng medicine dropper before mo siya ilagay dun sa gamot para pag release mo ng pressure, magkakaroon ng exchange of places. Yung medication, papasok, mahihigop siya, tapos kasi may negative pressure. Ibig sabihin, may pinindot ka dong area, so may negative pressure. So inside the thoracic cavity, ganun din po. Mayroong negative pressure. So anong ibig sabihin yan? Any break in that negative pressure can prevent or compromise the lungs' ability to inflate and deflate. So as I told you, ayan. So probably you have actually discussed this in your MS, no? So di ba yung thoracic cavity natin, for example, dito yan. Tapos you have your lungs. What is this amazing drawing? Work of art. Amazing. So this is a negative, this is in a negative pressure. So let's say, for example, ayan. So let's say, ano ba magandang i-drawing? What is this? Ayan. Hindi nyo lang po alam kung ano yan, but that's a gun. So halimbawa, you sustained a gunshot wound sa iyong thorax. And that because of that, so the wound was a through and through, sabihin na natin. So ngayon na meron ngayon etong air dito sa labas po is positive pressure air. Dito sa loob, sabi ko sa inyo, negative pressure po yan para magtuloy-tuloy yung inflation-deflation ng lungs mo. However, pagka pinabaril ka dyan, so there is now this one, yung positive pressure air, pumapasok po siya sa loob. No? So, ang tendency niyan, etong side na to will now be filled with the positive pressure air, and this side of the lungs will not inflate and deflate. And this is a condition known as pneumothorax. Pneumothorax. Ayan. When positive pressure air enters your lungs, causing the affected lung not to inflate and deflate. So, we call that as your pneumothorax. Ayan. Siyempre, pag dugo naman yung dumami dyan, hemothorax. Ayan lang. Okay, so the coordinated system enables the lungs to perform its primary function, which is, diffusion. So oxygen will now go into your cells, and carbon dioxide will go out of the blood into the air. So balik-balik yun, and then vice versa. What happens when we age? So when aging happens, there's limitation in your respiration because there is now stiffening of your elastin, and also yung collagen na connective tissue ng ating lungs is not as elastic as before. So when that happens, may problema ka ngayon dun sa inflation-deflation ng iyong alveoli. So the altered alveolar shape results in increased alveolar diameter, and that increase can lead to trapping of carbon dioxide. So it's possible that carbon dioxide will be trapped in your alveoli, and mas mahihirapan ka ngayon mag-exhale, kesa sa inhalation. So humahaba yung exhalation mo. Okay? Aside from that, there's decreased alveolar surface area available for gas exchange. So that's the reason why pwede rin magkaroon ng mas mababa kang oxygen levels of the blood. There's increased chest wall stiffness, stiffening of the diaphragm. So all of this are structural changes with aging. So what are the common diseases that is associated with older people? So isang example na doon at hindi yun mawawala sa lahat sa atin is the exposure to air pollutants, no? So that's the reason why, kahit parang nire-research nila yung way para ma-reduce yung air pollutants. Kaya lang kasi do you know that in research, so in one of the conferences that I have attended, there is this doctor whose life work is to measure air pollutants and to associate it with different diseases. Kaso sobrang hirap na siya. Actually, matanda na siya nung time na yon. Matanda na siya, pero hindi niya pa rin hindi siya makakuha ng traction dun sa research niya. Kahit naman napuprove niya na ang air pollutants nagli-lead sa mga sobrang daming sakit. For the reason that yung mga tao, they don't know how to stop it. Kasi kahit pa na-prove mo, let's say for example, that air pollutants, let's say, causes lung cancer or premature death, paano mo tatanggalin ng air pollutant? So, kaya nababawasan ng impact yung research niya because hindi naman kasi nila matanggal talaga yung air pollutants. So, that's the reason why. And then you have their cigarette smoking. So, cigarette smoking yan talaga rin ang number one cause ng mga respiratory diseases, not just of older people, but all person regardless of the age and gender. So for the respiratory diseases that we'll be discussing, I will focus on COPD, and then we'll discuss asthma and pulmonary embolism. So although tuberculosis is also one of the diseases, however, I think this is mostly for communicable diseases na lecture, no? And the lung cancer, you'll probably discuss the entire cellular aberrations when you are in fourth year. So aging results in so aside from respiratory changes, there are also changes in your neurologic function that affects obviously your breathing. And as you know, the part of the brain that controls your breathing is your medulla oblongata and your pons. So these are your respiratory centers, medulla oblongata and pons. Now, one of the things that you should note when we talk about our breathing is that I have a question for you, by the way. Can you control your breathing? Yes or no? Can you control your breathing?
No.
Sabi ni Rafael, no.
Yes po.
Who says yes?
Ma'am, siguro po yes, yung 'pag pinipigilan po natin huminga po.
Sino yun? Sino ka? Sorry, hindi kita kita.
Ramos po,
Ramos.
Ramos.
Sabi ni Ramos, ano daw, yes. Sabi ni Russell, no. Bakit no, Russell?
Ano siya, ma'am, I think it's automatic. Like, involuntary. Yun yung term siguro, ma'am.
Involuntary, so hindi natin kayang kontrolin.
Opo, kasi kahit like for example, pag tulog tayo, ma'am, yung ganun, or may ginagawa ka na yung favorite mo, yung mga ganung bagay po.
Okay. So, actually, you're both correct when you say, yes, it's controllable, but only to a certain extent. So, ang iyong breathing is actually controllable. So, bakit mo hindi mo pwedeng sabihin na no, it's not controllable? Kasi pag sabi mong no, hindi na tayo makapag-swimming. Kasi 'di ba, lahat tayo madodrown kapag di mo kayang kontrolin yung breathing mo. So, ibig sabihin, kaya mo pa rin siya kontrolin. That's also the reason why hindi mo sinasabi sa pasyente mo na kinukuha mo yung RR niya. 'Di ba? Kasi pag sinabi mo, mako-conscious siya, parang siya, 'di ba? Na-try niya na ba 'yon? Yung alam mo kinukuha ng tao yung respiration mo, parang medyo napapansin mo tuloy. So parang kinokontrol mo ngayon yung paghinga mo. So that is also another evidence that we actually can control our breathing, pero only to a certain extent. Because actually, the chemical in the body that controls our breathing, or what do you call this? It will make us breathe in, is your carbon dioxide. So it's not the oxygen, but the carbon dioxide levels of your blood are the ones that will cause you to breathe. No, carbon dioxide levels. So we call this as your hypoxic drive. So your hypoxic drive is the one that, ibig sabihin, hindi ka pwedeng magpakamatay by just, pigilan ng sarili mo maghuminga. Di ba minsan gano'n yung parang, minsan may mga batang nagtatantrums, tapos sasabihin nila, hindi ako hihinga. Ayan. Tapos parang sila nagpipigil ng hininga. So kung napanood niyo yung Despicable Me, si Agnes, di ba? No, pagka yung nagtatantrum siya, parang pinipigilan niyang huminga hanggang mag-blue siya. Pero actually, that's cartoons. Pero in reality, you cannot stop yourself from inhaling kapag ka na-reach mo na yung carbon dioxide levels na magkukos sa'yo mag-breathe in. Ayan. So actually, another thing is that meron tayong reflex na yung reflex na to kapag nag-exhale ka na daw. So, di ba, kung kaya mong kontrolin yung breathing mo, siguro, probably, for example, ako, sobrang frustrated na, scuba diving. Alam mo yan, yung gusto ko yung sumisid sa mga, punta kaming Coron, ganun, sa may mga diving sites doon, gusto kong mag-dive. Kaya lang kasi, hindi ko kaya na wag sa ilong huminga. Alam mo yon. Kasi di ba may mga practice na kasi hihinga ka sa bibig kasi nandun yung O2, di ba? So, parang hindi ko kaya na, inhale sa bibig, exhale sa nose. Nagkakamali ako. So, sabi ko, oh no, hindi pwede, malulunod ako dito. So, if you can control let's say, your breathing, maybe you don't need let's say, a scuba tank, no? So, isipin mo, mag-inhale na lang ako ng sobrang dami. Ayan, nahangin. Inhale pa, para magsisisid ako on my own. But you cannot do that because of the reflex known as your Herring-Brauer reflex. Herring-Brauer reflex, reflex is a reflex that says that if your lungs are fully inflated, it goes to, the next step will be exhalation. Ayan. So, pag napuno na, fully stretch ang lungs mo, ang next step na daw doon is wala kang choice kundi i-exhale yun. Yan yung sinasabi ng Herring-Brauer reflex. So, hindi ka pwede alam mo, meron ka lang tinatawag natin na total lung capacity. Yan. So, ibig sabihin, hindi mo ma-exceed yung iyong total lung capacity. Kasi, merong tinatawag na Herring-Brauer reflex. So, gayon din, yung, for example, di ba, nalunod ka, or tinapon ka ng pinsan mo sa malalim, hindi ka pa naman marunong lumangoy. Kahit anong gusto mo na, alam mo yon na wag hihinga. Kasi syempre, alam mo, tubig to. Hindi ako hihinga kasi tubig to. Malulunod ako. Yung lungs ko mapupuno ng water. I will have pulmonary edema. So, however, because of your hypoxic drive, you cannot help but breathe in. No? Kaya, ma-aspirate mo yung water. Okay, so that is because of the carbon dioxide levels of your blood. Okay, so kahit na anong frustration mo na maging katulad ni Percy Jackson, na anak ni Poseidon, from Rick Riordan, so hindi mo magagawa magstay doon for hours, no? So probably kung halimbawa tayo ay nakaka-breathe underwater, maybe some of us will decide to stay or have a house under the sea, no? So alam mo yun, dumadaan yung mga corals, feeling mermaid. Ayan. So ako ayoko naman maging feeling mermaid, baka mapagkamalan akong dugong. Ayan. So next is loss of muscle tone exacerbated by deconditioning, obesity, and sedentary lifestyle. So ano naman to? Isa sa mga nangyayari, of course, when you grow older, will be the fact that you don't exercise, you're obese. So kapag obese ka, ang problem mo dun sa lungs mo, hindi siya fully inflated and deflated, tapos mabilis kang hingalin. Napansin yung mga obese, mga ilang akyat pa lang yan ng steps, hingal na hingal. Wait, ayan. So naalala ko na naman, favorite kong stuffed toy tuloy. No. Cartoon character, si Po, sa Kung Fu Panda, di ba? So pinakaayaw niya, stairs. So, para sabi niya, my mortal enemy, we meet again, the stairs. Kasi yung, if you're obese, no, you will have problems with your breathing. Kasi, nadidisplace yung diaphragm pataas nung excessive fats, adiposity sa tiyan mo. So, ang nangyayari ngayon, yung lungs mo, hindi siya makapag-inflate, deflate fully kasi yung diaphragm tumataas. Parang pregnant woman. Di ba ang buntis, medyo hirap, parang hingal siya agad, no? So, yun din po yung nangyayari. Wait lang, hinihingal na ako. Ano ba yan? Inom lang ako. Okay, so alam niyo na kung bakit. Okay? So, next is your kyphosis. So, isa pang problem ng mga adults natin na nagpo-pertain sa neuromuscular disorders nila is your osteoporosis. So yung osteoporosis can lead to a condition known as your Dowager's hump. So kung naalala nyo, last time ba yun? Yung diniscuss natin osteoporosis, yung meron siyang hump dun sa thoracic cavity. So ang tawag dun is Dowager's hump. Let me write it down for you. Dowager. This is very characteristic of osteoporosis. So, ano nangyayari dyan? Yung hump niya, very specific. So, if this is the person, dito yung kanyang pagkakuba. Ayan. So, yan. Halimbawa, yun yung matanda. Yung thoracic cavity yung nakukuba. Yun yung Dowager's hump. Okay. So, others will be the use of medications. It can lead to your compromised breathing, and also some neurological impairment, which includes dementia, Parkinson's, stroke, and cerebrovascular accidents. So for respiratory infection, so ang pasyente mo at risk for pneumonia, bronchitis, sinusitis, rhinitis, and influenza. So kaya nga 'di ba may mga flu vaccines for our elderly, because of the fact na medyo compromised na kanilang immune system, so medyo mahina yung panglaban nila for yung mga respiratory infections. Lalo na COVID ngayon, di ba? However, we'll deal with this disorders. Ang pinaka-specific is your COPD, and under that will be emphysema and chronic bronchitis. Now, COPD stands for chronic obstructive pulmonary disease. There was a time that under COPD, there are 4 diseases. You have emphysema, chronic bronchitis, asthma, and bronchiectasis. However, they figured out that asthma cannot be a COPD kasi it can be managed and it can be reversed. So, ang characteristic kasi ng COPD, it is chronic and it's also irreversible. Yun ang characteristic ng COPD. So, another is yung bronchiectasis. So, there was a time that bronchiectasia or bronchiectasis is considered as one of the COPD, pero they have figured out that this is actually a condition that is a complication of having COPD. So they removed it also from the list. Now, what is COPD? So COPD is a group of disease which includes emphysema and chronic bronchitis that is caused by permanent damage to the airways that causes irreversible airflow limitations. So hindi mo na siya kayang magamot sa pamamagitan ng medications because it's irreversible already. So what are the characteristic signs of patients with COPD? As you can see in the picture, you have there your smoking as its number 1 risk factor. So COPD patients, number 1 risk factor is smoking. So aside from that, you will see in your patient the classical need for oxygen and the classical activity intolerance. So hirap siya sa mga simpleng activities. Gumagamit siya ng accessory muscles for breathing, just like your pursed lip breathing. So gamit yung orbicularis oris, which is the muscle around your mouth, tinutulungan niya yung sarili niya makapag-exhale kasi matagal siya mag-exhale. So pag inhale niya 1 second, pag exhale niya 3 to 5 seconds, mas matagal. No? So very characteristic of COPD. Aside from that is your tripod position, which is what you can see in this patient, also known as your orthopnic position, meaning upright position leaning forward. That is known as your orthopnic position. I just refilled my water. Okay, so let's continue. So under COPD, you have emphysema and chronic bronchitis. So isa-isay natin. So emphysema is also known as your pink puffers with the characteristic, kaya siya pink because of the characteristic carbon dioxide retention that causes pinkish discoloration of the skin. It has a characteristic barrel-chestedness and pursed lip breathing. The other one is known as your chronic bronchitis. With kaya siya chronic bronchitis, it's called blue bloater because of the characteristic cyanosis and edema. No? So yan ay blue bloaters. Okay, so let's now look at your at each of them one by one. Beginning with your emphysema, also known as your pink puffers. Now, under COPD, what happens with emphysema is that your patient has an abnormal, irreversible enlargement of your alveoli. So, si alveoli ko, kapag ako ay may emphysema, is now inflated, okay? And it traps carbon dioxide in it kasi meron ding narrowing ng airway ko kasi doon sa terminal bronchioles ko, merong dilation ng mga air spaces. And that leads to your lung collapse. So etong nangyayari dito, as you can see here, it will now cause your carbon dioxide to be retained. Yan. So ito po yung CO2, retained siya. And so the CO2, kapag na-retain siya, alam niyo naman, acid-base balance tayo. Pag si CO2 na-retain, syempre, nakakombine siya sa water, so it becomes carbonic acid. So ang gagawin niya sa pH mo, bababa ang pH mo, at magiging respiratory acidosis. Kasi nagre-retain ka ng carbon dioxide. So this is very classical for patients with emphysema. Now, carbon dioxide in the blood, no? Pag nag-bind siya sa dugo mo, causes the characteristic pinkish discoloration. Ibig sabihin yan, yun yung CO2 retention, no? So nagiging pinkish ang pasyente. Okay? So aside from that, patients with emphysema will have what we call as your barrel chest. Yan. So dapat yung transverse diameter, okay, let's look at the pathophysiology. So hindi to ganun ka-detailed, no? Basta this is the exact, this is the, what do you call this? Very fast lang na pathophysiology, concise. So because of recurrent inflammation due to probably smoking, kasi di ba sabi nga natin, one of the major reasons for your COPD is smoking. When you smoke, no, ang nangyayari is that the smoke actually damages your epithelial cells. Rather endothelial. Damages your endothelial cell, which is the endothelial lining, lining of your alveoli. So when there is damage, inflammation will be triggered. So you will have an inflammatory response. This inflammatory response, okay, paulit-ulit, laging nangyayari. So inflammatory responses usually causes the release of different mediators, chemical mediators for inflammation. At ang ilan sa mga yon ay mga proteolytic enzymes. Yung iba naman, kaya ka may proteolytic enzymes sa iyong inflammatory response kasi supposed to be, ang inflammatory response is your response to a foreign body. So supposed to be, kaya siya nag-respond, meron kang bacteria. Okay?
Kaya ko ako magpo-punch.
Hello?
Join ka.
Kaso,
Hello?
kuya, tayo nito.
Hello? Ayan. Nangyari. Hindi ko kayo kita. What happened? May question? Hello?
Napindot
Wala
lang
po.
po yung mic nun. Okay na po.
Okay. Kala ko may tanong eh. Hindi ko maintindihan. Okay. So, supposed to be the inflammation is caused by a foreign body. Okay? So, dahil may antigen, may foreign body, so nagkakaroon ng inflammatory response kasi lalabanan mo ng katawan mo. However, this time, ang problema mo, smoker ka. So, yung smoking ngayon, nag-cause ng damage sa endothelial lining ng iyong lungs, ng iyong blood vessels. So, ngayon, nagkaroon ka ngayon ng inflammatory response, not because of a foreign body, pero still, all the chemical mediators of that inflammatory response will be released, including the proteolytic enzymes. From the word itself, ang proteolytic enzymes will destroy proteins. Kasi supposed to be, yung mga bacteria mo ay merong mga cell membrane. Eh yung cell membrane niya, yun ang tutunawin niya, supposed to be. However, during this time, wala ka namang foreign body, so anong gagawin na lang niya? Ang sirain niya is your bronchioles and your alveoli. And it causes damage, and eventually, it will lead to your atelectasis, which is also known as your lung collapse. Atelectasis. Yan. Also known as your lung collapse. And this now causes decreased elastic recoil, the airway to collapse, and therefore, there will be decreased area for gas exchange to occur. Thus, the diagnosis of COPD. So, patients with emphysema will develop barrel-chestedness. Ibig sabihin, tumataas yung anterior-posterior diameter na medyo nagiging kapareho na ng transverse diameter. Supposed to be, as you can see here, the transverse diameter, yung side-to-side mong mong diameter is longer than the anterior-posterior diameter. However, here in the patients with barrel chest, so ano nangyari? The anterior-posterior diameter has increased, causing you to have the appearance of barrel-chested. Di ba yung barrel ang itsura niya? Isang bilog. No? So, kasi, ibig sabihin yung anterior-posterior diameter mo ay lumaki. No? So, it's actually a sign na hirap kang mag-breathe. No? So, ginagamit mo yung mga accessory muscles mo for breathing. The most commonly used accessory muscles for breathing are your sternocleidomastoid muscle, your pectoralis muscle, and your intercostal muscles. So, alam mo, intercostal, in between your ribs, pectoralis is the chest muscle, and sternocleidomastoid is the muscle on your neck. Yan. So, usually, ito yung mga ginagamit na accessory muscles for breathing ng mga pasyente natin na may problem ng COPD. So, you have dyspnea, tachypnea, and orthopnea. So, ibig sabihin, pag sabi mong dyspnea, hirap huminga, tachypnea, mabilis. So, it's greater than 25 cycles per minute. Then you have orthopnea, hindi siya makahinga pag naka-flat. Yan. So, hindi siya makahinga. Prolonged expiratory period with grunting. Normally, ang exhalation mo 1 second, ang inhalation 1 second, tapos ang exhale 2 seconds. Normally, inhale, exhale, 1, 2. Yan. Inhale, exhale, 1, 2. So, ganun lang. Pero kapag ang pasyente mo may emphysema, usually it takes longer. Okay? So, gaano kalong? Sometimes it is 3 to 5 seconds. Okay? Ang may mga pasyente mo may emphysema. So, instead of breathing, inhale 1 second, 1, exhale, 5 seconds. At dahil nga dun sa mahabang pag-exhale niya nun, nakikita mo ang pasyente mo ng pursed lip breathing as a compensation for the long expiration period or the long na pag-exhale niya. No? So that is now your emphysema. Now, what do we do? What are the interventions for patients with emphysema? So low O2 is prescribed for the patient, about 1 to 2 liters per minute only. Hindi pwedeng mataas because the reason for this, yan, pag tinanong sa board exam, to preserve the hypoxic drive. That's the rationale. Kasi ang mga pasyente mo daw na may COPD, sanay sila sa low O2 concentration. Sanay. Matagal na nila yan. Kasi di ba may chronicity ang COPD. So sanay sila sa low oxygen concentration. Kapag daw tinaasan mo masyado ang oxygen nila, may tendency sila na hindi sila mag-breathe. No? It can lead to apnea. Okay? Kasi sanay sila sa low oxygen concentration, tapos binigyan mo siya ng masyadong mataas sa oxygen, it can lead to apnea. Okay? So, advise pursed lip breathing kung hindi pa nila ina-assume yan, kasi usually they already do it. Position in high Fowler's position. So, this is the position that aid in breathing. So, pag walang high Fowler's sa choices, upright position, pwede rin pong tripod position, pwede rin pong orthopnic position. Isa lang po yan, high Fowler's. Next, you give bronchodilators, aminophylline, theophylline. These are the commonly given. You have also terbutaline. Antibiotics are usually given to prevent secondary bacterial infection. Pero walang positive agent ang emphysema, so ibig sabihin, it's only given prophylactically. So, prophylaxis. Corticosteroids are given to reduce inflammation. That's the purpose. Reduce inflammation. So this is your emphysema. The next disease is known as your chronic bronchitis. So ito po pala ginagamit sa older adults natin to encourage breathing. Why? This is known as your incentive spirometer. So kasi may tendency ang mga matatanda na magkaroon ng shallow breathing. In the shala, la, 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 low. Ayan. So, Ayan, so we're far from the shallow now. So para malayo ka sa shallow breathing, you give incentive spirometer. Paano yun, ma'am, nagbibigay ng incentive? Kasi may nakikita siya. Tapos sasabihin ng doctor niya, oh, tatay or lolo, ang goal mo, ma-achieve mo itong halimbawa, green level, which indicates good breathing or malalim na breath. So ang gagawin niya, hihinga siya, okay? Hihinga siya, i-inhale siya, tapos may meter dito na may color dito or yeah. So makikita niya kung tumataas na, ibig sabihin good breathing. Hanggang maabot niya yon. So ang tawag dyan, incentive spirometer. Okay? So ang purpose niya to maximize lung inflation and prevent or reduce atelectasis by encouraging the older adult or kung sino man yung gumagamit niyan to breathe deeper. Okay? So ang purpose nito, breathing deeper. Okay, let's now talk about blue bloaters or chronic bronchitis. The problem with chronic bronchitis, itis, inflammation, chronic, matagal na, bronchitis. So bronchi is the part of your respiratory tract that affected. For patients with chronic bronchitis, the problem is your purulent mucus production or very productive cough. Yan. So yung kanyang bronchi, it's so used to the insults of smoking. Ayan, so marami siyang pinaproduce na mga phlegm. Okay? So ang pasyente mo, laging may plema, laging may ubo. So the diagnosis of this, as you can see here, productive cough for at least 3 months per year. For isipin mo, 3 buwan kang may ubo. For almost like 2 years na yon na tatlong buwan ang haba ng ubo mo. Normally, so ang cough process takes about 1 week. Pag greater than 2 weeks na po ang ubo, we consider that as your nagging or persistent cough. Yan ang term natin dyan. Nagging or persistent cough. If it's more than 2 weeks, eto, 3 buwan ka, may ubo. So, ibig sabihin, your cilia, have you ever heard of smoker's cough? Kung may kapitbahay kayong smoker or meron kayong family member na smoker, as in yung chain smoker or have been smoking for quite some time, ang smoker's cough, every morning, there is accumulation of phlegm sa kanyang respiratory tract. Kasi po, ang smoker's cough, di ba, you insult your cilia, your respiratory system with the cigarettes. So, pag natulog ka, syempre, grabe ka naman kung nag-i-smoke ka pa habang tulog, no? So, pag natutulog ka, nakaka-recover yung iba mong mga cilia. Sa kanilang pagka-recover, sinisweep away nila palabas ng iyong respiratory system yung mga plema. Okay? So, yung mga mucus, sinisweep out nila. Kaya sa umaga, pagkagising ng smoker, meron lagi siyang plema sa throat. Kaya maririnig mo na yan sa umaga, parang alarm clock mo, gano'n. Diba? So, yan po ang tinatawag natin smoker's cough. Okay? So that can lead to the destruction of your respiratory, your airways, and you will have your chronic bronchitis. Now, for patients with chronic bronchitis, ang nangyari, yung cilia nasira, yung kanyang bronchi laging inflamed, so nawalan na ng elasticity, sobrang daming mucus ang na-produce, nagkaroon ng excessive mucus glands na po-produce pa, nagdagdag pa kasi sobrang daming mga kailangan na i-engulf, no, na mga insult, no, inflammation. So because of that, narrowed yung airways. So ngayon, ang nangyari, hirap ka ngayong huminga. And that limitation in your breathing causes the decreased oxygen delivered in your blood, causing cyanosis. So for patients with chronic bronchitis, isang classical sign po niyan is your cyanosis. Okay, so there is increased carbon dioxide in the blood and decrease oxygen in the blood, causing the bluish discoloration. Ma'am, pero bakit siya naging bloater? So this is associated with a condition known as right-sided heart failure. Okay. Ang right-sided heart failure mo, pag ang reason niya ay respiratory disease, or for this matter, COPD, this is known as your cor pulmonale. And usually it's a complication of a prolonged respiratory condition. Cor pulmonale, ang term natin, kapag nag-fail ang puso dahil sa lung issue. So that's cor pulmonale. And usually, left side ng puso ang unang nag-fail. But for patients with respiratory diseases, ang nag-fail right side of the heart. And that is called cor pulmonale. Okay, so for chronic bronchitis, itong binibigay natin, increased humidity, oxygen, same lang nung emphysema. So siguro ang nadagdag lang is chest physiotherapy. Chest physiotherapy. So chest physiotherapy has 3 steps. Number 1 is postural drainage. Ang postural drainage, ang una mong gagawin, syempre, dapat chest physiotherapy should be done before meals and before sleeping. So postural drainage, ayan, ang gagawin mo muna, using a stethoscope, pakinggan ang lung sounds ng pasyente para malaman mo nasaan ang mga plema. Once you figure out kung nasaan ang plema, position the patient where gravity will drain the phlegm. Halimbawa na pakinggan mo, meron siyang phlegm, ma'am, sa right lungs. Yan. Napakinggan mo, may phlegm sa right lungs. So, paano mo daw siya ipoposition? E di left side lying. Ganun. Kasi narinig mo na sa right lungs niya may abnormal breath sounds. Halimbawa may narinig kang mga rowels. O kaya crackles. Yan. So, ngayon, ang gagawin mo, position the patient left side lying para yun sa postural drainage. So, by gravity, para daw matanggal yung phlegm dun sa area na yun. Number 2 is your bronchial tapping. Bronchial tapping is what you will do is you cup your hands. Yan. Alam mo yung parang ginagawa ng masahista. You will cup your hands and then tap the area kung nasaan yung mga secretions to loosen the secretions. And then third is vibration. Vibration lang is with the palm of your hands and the other part and your other hand on top of your hand, you will vibrate that area where there are secretions. Okay, so that is called vibration. So I have postural drainage, bronchial tapping, vibrations. That's part of your chest physiotherapy. So bronchiectasis, nabanggit ko na to sa inyo kanina, it's a condition that is happens due to COPD patients. It's an irreversible condition of the bronchi wherein it is permanently dilated. Sira na yung mga walls, tas permanently dilated siya, ang tawag natin doon, bronchiectasis. Ang characteristic niya, marami rin yung iyong excessive mucus production, tas yung mucus niya mabaho. Can you imagine, yung phlegm ng patient mo, foul-smelling. Okay? So that is bronchiectasis. Now, what about asthma? For patients with asthma, this is usually hypersensitivity of your airways due to a trigger. So there is always triggers to asthma. So these are your different triggers. You have your 3 E's: exercise, environment, and emotions. So obviously, it's good for the patient to know their triggers. So kung si tata yan, si lolo yan, kailangan gumamit siya ng diary, tapos ilalagay niya sa diary kung kailan siya hinihika para malaman niya ano ba ang trigger. For me personally, isa sa mga trigger ko kasi is overexertion. yung halimbawa nagle-lecture ako, just like what I do now. Tapos, let's say, some of my lectures sometimes is 8 hours. So, lalo na sa review, ang lecture ko is, let's say, 8 a.m. until 5 p.m. Tapos, ano yun? So, halimbawa, next day ulit, ganun ulit, 8 a.m. to 5 p.m. Tapos yun. So, pagdating na Friday, mga ganyan, no? Yun na, magsistart na ako with dry cough. So, una man na itchy throat, then dry cough, yun na. Tapos after that, hihikain na ako. So, that is what happens when you have asthma, no? So, it could be overexertion or exercise, environmental factors. So, pwede rin na merong trigger sa environment like dust mites, pollen, pet dander, yan yung mga balahibo ng pusa, yung mga ganyan. Molds, so all of this can be environmental factors. Perfumes, ako sobra yan, yung ilong ko, mag-start na kumate pagka merong nag-spray ng, alam mo yan, ng medyo matapang na perfume, ayan, makati na agad yung ilong ko. So, these factors can trigger your asthma and even emotional stress. So, emotional stress can actually trigger asthma. Yung pag-iyak ka ng iyak, ayan, bigla ka ng hinika. So, ano bang classical signs ng asthma? So, you will have, of course, difficulty of breathing and wheezing. So, classical sign is wheezing on exhalation. Pag pinakinggan mo with the stethoscope, yung kanyang breath sounds, you will hear the wheezing sound, which is a musical note, a high musical note. Ganon. It's a characteristic sign that the air is passing through narrowed airways. Then the person can have orthopnea, dyspnea, and cough. So intervention will be high Fowler's, O2, increased hydration, humidifier, to loosen the secretion, of course. So humidify, meaning increased fluid intake. Postural drainage also, and then, syempre, ang main thing is for you to control asthma is for you to avoid whatever triggers. So yung mga triggering factors mo, i-avoid mo yon. Kaya ka nga nagda-diary para malaman mo ano bang nagkakos nito. So that is asthma. So the medication of choice will be bronchodilators. So theophylline again. So pag theophylline, isang kanyang side effect is tachycardia. That's why nakalagay dyan, monitor heart rate. Because ang theophylline can cause tachycardia. Okay. Aside from that, you can be given corticosteroids. So yung mga corticosteroids, yun yung nakalagay sa mga inhalers nyo. So, kapag ikaw ay nag-inhaler, so yan, corticosteroids yan. So, meron tayo lang negative effects kapag long-term use, tas lagi mong ginagamit. So, you can have Cushing-like symptoms. So, you have to check with your doctor about that. So, pero ang purpose niya is to reduce the inflammation. Antibiotics are given, pero it's prophylactic in nature kasi hindi naman bacteria ang causative agent ng asthma. It is allergy. Cromolyn sodium is given. It is an antihistamine that is given to prevent your attacks or even given during an attack. So, these are your medication. Okay? So, just to give you, this is something that you should know already, pero review lang, paano gumamit ng inhaler. So, the thing that you do is first hold it 2 finger breadths or 1.5 inch in front of your mouth. Then before you puff, you breathe deeply and then puff and then inhale. Hold your breath. Pagka-inhale mo ng gamot, hold it for 10 to 15 seconds and then saka ka mag-breathe out from the mouth with pursed lip breathing. Tapos after that, if you still need another dose kasi hindi pa na-relieve, kasi dapat instant relief yon. Pag di pa rin na-relieve, you need another dose. So you wait for at least 1 to 2 minutes in between dosage. Okay? And then after that, check the patient's heart rate for any signs and symptoms of tachycardia. Ito na yung banggit ko kanina, cor pulmonale, right-sided heart failure due to problems of the lungs. Okay. Lung cancer, okay. Immune system. So yan, respiratory infections. That's the reason why kailangan ang mga patients natin ay especially elderly, nagkakaroon sila ng annual physical check-up para makita yung kanilang respiratory function through X-ray. However, chest X-ray is not a good way to detect lung cancer. So that's why it's now removed from the routine tests to check for different types of cancers. Then pulmonary embolism. So pag pulmonary embolism, the word itself, embolism, embolus, meaning may clot na nag-travel. So ang pulmonary embolism, nangyayari siya sa mga pasyente natin na posibleng immobile o paralyzed, tas hindi siya na therapy. So dun sa kanyang legs, nagkaroon tuloy ng clot. Yung clot na yun, nag-travel, napunta na lodge sa pulmonary system. Yan yung pulmonary embolism. So for patients with pulmonary embolism, sometimes it happens that the clot begins in the legs or deeper veins. So we call that as your deep vein thrombosis. If a clot is formed in the deeper vein, it's called deep vein thrombosis. And I'm not sure if this is the class that I told you this. So deep vein thrombosis is, ang address dyan is yung Virchow's triad, which is the triad of Virchow's. Virchow's triad. So it's the triad of symptoms or risk factor, rather, triad of risk factor. So ito ay vein damage. So pag may damage yung iyong vein, like varicosity, blood stasis, hindi masyadong gumagalaw ang dugo, yan, sa iyong legs. And also, increase blood viscosity. So if you have these three conditions, you have a high risk for deep vein thrombosis. So this leads now to the emboli. Ibig sabihin, magbabiyahe yung clot from the area na form siya, papunta sa different areas. Siyempre, pag pumunta yan sa heart mo, magkakaroon ka ng MI, myocardial infarction. Pag pumunta sa brain mo, magkaka-stroke ka. You have your cerebrovascular accident. Pero pag pumunta sa lungs mo, you will have pulmonary embolism. Okay? And that can lead to the death of the different parts of your lungs. So yun yung infarction. And this is a medical emergency. So for patients with pulmonary embolism, assessment will be sudden onset of dyspnea and blood-tinged sputum together with chest pain. So the patient will also have signs and symptoms of shock. So you have hypo, tachy. Yun. Okay? So for patients with pulmonary embolism, so we give high Fowler's, O2 is given. And syempre, ang main medication mo dyan are thrombolytics and heparin. So thrombolytics, yun yung may mga kinase. Ang purpose niya, dissolve clot. Yung heparin, warfarin, ang purpose nila is to prevent further clotting. And then, kapag ka masyadong malaki yung clot or hindi pa nag-take effect ang thrombolytics, the doctor might opt for a surgical removal, which is embolectomy. The surgical removal of the embolus from your from the pulmonary arteries. Embolectomy. Okay, so that's pulmonary embolism. Thank you. That's the end. Okay. Do you have any questions? Did you understand?
Yes.
Yes po, ma'am.
Yes po.
So, is it a repetition of your lecture sa NCM 112? Medyo repetition ba?
Yes. Yes po.
So, that's okay. So, with repetition comes memorization. Tama ba? And understanding. Okay, so that's the end of our class. Yes. Finally, I'm gonna rest. Okay, so, your quiz on respiratory... Ay, wala na pala. Kasi exam. So, wala na quiz sa Respi kasi part na siya ng midterm exam. Okay, so I'm not gonna see you on Saturday because I'm not one of your lecturers, but you will have the quiz and it's already done. It's a cardiovascular system. That's it. Bye, class.
Thank you po.
Thank you po, ma'am.
Thank
Po, ma'am.
you po, ma'am.
Thank you
Thank
po,
you po.
ma'am.
Bye.
Thank you po, ma'am.
Thank you po.
Thank you, Respi.
Thank you po.
Aral sa exam. Thank you.
Thank you, ma'am.
Welcome.
Thank you po, ma'am.
Welcome, Jam.